I'm Dr. David Levine, and today is May 18th, 2024. I'm in Boston, Massachusetts at the annual meeting of the American Association of Plastic Surgeons. In a nutshell, I have the honor of interviewing icons of plastic surgery who are teachers, authors, and innovative surgeons who have been the principal reason that plastic surgery is where it is today. Today, I have the distinct honor of interviewing Dr. James Zins. Jim, pleasure to meet you.
Very nice to meet you.
Thank you. So the first question that I have for you is pretty simple. State your full name and date of birth.
My name is James Edward Zins. I was born May 17th, 1948. My mother used to call me James Edward, but most people call me Jim.
Okay. And your parents' names?
My dad's name was Eugene Irwin Zins, and he was an internist, and my mom's name was Adele Zins.
Okay, which is a full-time job, a housewife, or did she have?
Interestingly enough, yeah, she was a full-time stay-at-home mom in the early years of us growing up, and then she actually went to school at night from New Jersey, drove to New York, and got her MA in psychology and practiced psychology for many years.
Okay. Now, so you were born in
Newark, New Jersey.
Newark. Okay. Mm-hmm. Okay. And how many children, grandchildren?
Actually, no kids.
Okay. Yeah. Okay. How did you said you met your wife?
That's quite a story. My wife was I actually met her initially when I was a resident in cardiac, doing my rotation in cardiac surgery. I was a miserable individual, working every other night, and she was a medical student. Well, she then started general surgery, and I was a senior general surgeon at the time, general surgery resident at the time. She started general surgery as junior resident, but she actually matched out of our Penn program, and she went to the University of Vermont. Well, a couple of years later, I'm scrubbed at the scrub sink to my last day in general surgery. I'm about to start my plastic surgery residency with Peter Randall as our chief. Peter comes up to me and says, Jim, so-and-so has sent me a telegram today saying he's not coming. Well, they had, in their great wisdom, they had taken a 42-year-old urologist into our program as our third plastic surgery resident. The day before the residency, he decides he's not coming. So I go up to my mentor, Linton Whitaker, and I say, Dr. Whitaker, I know this Cindy Kavaksorian, she's at Vermont, and she would love this position. Well, in those days, you had to, it was dictum, you had to have 5 years of general surgery training. You couldn't possibly become a plastic surgeon. And she had had only 3 years of plastic surgery, so she could actually become a plastic surgery resident by the rules of the ACGME and the Plastic Surgery Board. So he said, "Do you really think she'll take it?" I said, "In a heartbeat." So I call her up and I say, "Cindy, there's this position that they could offer you to come and be a plastic surgeon at Penn." She said, "Well, do you think I should take it?" I say, "Are you crazy? You'll save yourself 2 years of plastic surgery." So she came, and we became friends, and things went from there.
And she's a plastic surgeon?
So she's a plastic surgeon.
There's a rarity. There are a few. Yeah. Rod Rourke.
Yeah, there are a few. We ought to have a club. We'd have a club.
Yeah. It'd be a small one.
Yeah, it would be a small one. Yeah.
Interesting.
So the only proviso that Peter made for her was that she had to do a fellowship after she finished. So she actually did a Curtis Hand Fellowship when she finished plastic surgery. And it's interesting enough, she came in, and of course, after only 3 years of general surgery, she was quite far behind myself and Dave, who was our second resident. But in no time, she caught up.
Wonderful. Yeah. Now, back then, I think, wasn't there straight surgical internship that you could put as a year toward plastic surgery?
The rules,
they don't have that.
No,
anymore.
The rules were there was a 3-2 program. You could do 3 years of general surgery, and then do 2 years of plastic surgery in this so-called combined program. But at Penn, that was taboo up until this incident.
Right. And so Peter Randall was your chief.
Peter was my chief.
Yeah. And Linton Whitaker He was on staff up there?
Yeah, Linton was on staff. Linton, when I started internship in general surgery, Linton was 41 years old.
And that's the thing, by the way, I love about these interviews. We're talking about people that are, change plastic surgery.
Yeah.
I can't, after this is over, I got to tell you a Litton Whitaker kind of story.
I'd like to hear that.
It was a subperiosteal facelift.
Oh, okay.
Yeah. Anyway, this interview's about you, so we'll continue on. I can't remember if I've interviewed him or not. Honestly, I know.
I'm sure you have.
Yeah,
I'm sure you have.
Because I think I brought this story up to him. What inspired you to go into plastic surgery?
Well, when I was a fourth-year medical student, I had the opportunity to work with Project Hope in Maceió, Brazil. So I was actually on the ship Hope, and I ran into a wonderful plastic surgeon from Chico, California. And he made plastic surgery so much fun. We did a bunch of clefts in Maceió, cleft lips and palates, and I was hooked from that time on. My first rotation as an intern was in plastic surgery, and that's when I met Litton Whitaker. And in those days, those were the very early days of craniofacial surgery. And so every day in the operating room, we were doing something different and something innovative. And it was just, a spectacular, very unique time, I think, in plastic surgery.
That was a golden era. And we sit here and we kind of lived through it. And like breast reconstruction was flaps.
Yeah.
Nobody did submuscular. Radical mastectomies were what they were done. And then you had to deal with that. And didn't take long that we went from there to ultimately free flaps and all the in-between operations to create the perfect breast.
It doesn't seem long. It doesn't seem long now, but it was a couple of years.
Yeah. And in any event, that it's exciting to be part of a profession that, and Dr. Tessier. Yeah. Now, I didn't get to meet him, but I did spend 6 months in Houston. And of course, when he came, the world stopped.
Well, that was a very interesting time. That actually predated my training. But when Paul Tessier, when in the early 70s, Paul Tessier, as you know, came to the United States and went to various units, went to Toronto, came to Penn, went to Houston, and operated. And actually, that's how many of the early craniofacial surgeons got their so-called fellowships, besides going to Paris and watching him operate there.
Right.
So their fellowship was basically watching Paul Tessier operate.
Yes, yeah. Interesting. Again, there's not many degrees.
Fascinating.
Yeah. Okay, you've seen a lot of momentous paradigm shifts in plastic surgery during your career. We've kind of touched on it, but in your words, tell us a little bit about that.
I think probably the most momentous change has been that of free flap surgery. I think that's really changed plastic surgery reconstruction and head and neck reconstruction, breast reconstruction, lower extremity reconstruction in a quantum leap in quality. I think that's probably the biggest advance. Craniofacial surgery, has now expanded to the fact where it involves far more than just pediatric craniofacial deformities. Now, the craniofacial units really are doing obstructive sleep apnea. They're involved. All of transgender surgery, the entire facial feminization effort is basically applied craniofacial surgery. So we're taking craniofacial surgery now. It's very much like microsurgery. Microsurgery is a technique that we apply to many fields in plastic surgery, many subspecialties in plastic surgery. Craniofacial surgery is a technique that we apply to aesthetics, we apply to facial feminization, et cetera. So I would say those are the two most profound changes in plastic surgery that I saw in my career.
And that, what you just mentioned, hit on something that makes me so proud that now I'm retired, but when I was a plastic surgeon, and it was a quote I saw in a book once, which I love, which was learn principles, not methods. The mind that grasps principles will devise its own methods. You can learn one procedure and you can apply it in plastic surgery to something else. The shift is not that great where you say, let's do this. That's the fun thing about our profession. There's so many other things you can do.
I think that's so important in education. I tell the residents always is don't memorize, don't learn by rote. Okay, learn principles. They will stick with you for the rest of your career. learning rote memorization, you'll forget that by the time the exam's over.
Right, right. Okay, I asked you about what you think the most innovative, or maybe I have it, about the most important innovation, our specialty at this point in 2024.
No, as I said, I think probably those two issues, free flap surgery and the expansion, the techniques what we developed in microsurgery to apply to various other areas. Those are really, I think, the two biggest innovations that I would mention.
What do you feel is your greatest professional accomplishment?
Well, yeah, I hate to talk about I'm not good at talking about myself, but I would say my greatest accomplishment really surrounds education. I was the chairman of plastic surgery, Department of Plastic Surgery at Cleveland Clinic for 31 years. I think that's a record, and I think that's a record that will never be broken, given how medical economics runs today. So that was probably my greatest accomplishment. We took a residency, which when I took over as a chairman was on probation.
Yeah.
We had 4 residents. Today, we've had RRC reviews and had 5-year approval every year. We now have 25 residents and 25 staff. So we went from 7 staff, 4 residents to 25 residents and 25 staff. From an independent program, which is clearly not the best way to train residents, to an integrated program where our residents spend 6 years with us from day one. That's really the way to train residents, I think. So those are the biggest.
How many residents have you trained to this
Oh my
point?
God.
And any chiefs of plastic surgery?
Oh my God.
Good, tell us.
The number, I couldn't tell you. I couldn't tell you the number. We went, as I said, from 5 residents to now 25 residents. We graduated 2 a year. Now we graduate 3 a year in a 6-year program. So hundreds of residents. I've also, I think, very proud of the fact that I could represent the association in the aesthetic sphere, because I think the aesthetics is probably underrepresented in the American Association of Plastic Surgeons. So being able to represent aesthetic surgery and bring aesthetic surgery problems to the forefront of the American Association has been something that I've been proud of as well.
And I saw that I believe I read your interest in transgender surgery.
Yes.
And when I was at University of Virginia, second year, Milton Edgerton came.
Of course.
And I tell this story on the interviews, but I love telling it. And Milton's in there unpacking boxes, physically unpacking them. And we needed to get a mentor. UVA said, need a mentor. I knock on his door. I figured he couldn't refuse me. He's only been here a day. And he became my mentor. That was his description. And of course, what he had done, what he brought to the University of Virginia, first Department of Plastic Surgery. And I interviewed him. He was my first interview in Charlottesville 10 years ago. And to date, I've probably done 40 plus interviews. And in any event, it was fun because he brought so much to the table. Nobody knew what plastic surgery was till he came. So,
well, Milton Edgerton was quite a craniofacial surgeon, and at the time he promoted the use of alloplastic implants, which was absolutely taboo among the craniofacial surgeons in Philadelphia, Toronto, etc. And now, interestingly enough, we've made the full circle, because implants certainly have replaced bone grafts, cartilage grafts, etc. for craniofacial reconstruction. So maybe maybe Milton was right all along.
Well, if you live long enough, you always see the wheel come full circle.
Did you get a chance to get to his farm?
Oh, yeah. I stayed across the street, the Foxfield Inn on Rugby Road. What a farm. Yeah, that was an organic farm. He had pigs there, and I thought, oh, it's going to smell. No, it didn't. And his family lived, he had 3 generations on there. And he'd go out every day, and he'd hit golf balls in his backyard. He didn't pick them up. He said he had the guy work for him picked up. But that's what he did. Milton lived to be 98, I believe, or something. And when I went up to interview him, didn't miss a thing. Brilliant.
How long was he chief at UVA? I don't know. Quite a while.
I think it was one of those forced retirement things. So I'm saying 25 years.
Yeah, it was a long time.
And the program's a little different now than it was with him there. He trained over 30 chiefs.
Wow.
Classes. Fisher, Marsh.
Sure.
Yeah, I mean, that was kind of where that was the school to go. That was the place to go if you wanted to be a chief of plastic surgery. What do you feel our greatest mistake has been as a specialty?
Mistakes. I think I would say two. I would say one is the egress from the hospital. Many plastic surgeons now spend little or no time in the hospital. And that's bad for the specialty. You no longer interact with the other surgeons. You no longer learn from the other surgeons. You're not as able to help them with complex problems, which they may come upon. So I would say that's one. The egress from the hospital itself and into your own ambulatory surgery center. And I think that's one major problem. And the other problem, I think, is that of education. And I think that we need to make sure that we continue to innovate in education. We've had a 6-year program now, integrated program. I think most will agree that that is the best way to train plastic surgery residents, although not all will agree. But I think we now have to look to how are we going to best train these surgeons so that they're out there practicing plastic surgery at the very best of their abilities. And I think that means developing some system of allowing them to subspecialize in the area of special interest in their 6-year plastic surgery residency. So calling it a mini fellowship is probably a bad idea. We're calling it focused training in plastic surgery. This is a concept that I've pushed at the American Board when I was the head of the aesthetic committee at the American Board of Plastic Surgery, something we're doing at the Cleveland Clinic. And I hope, a lot of people are talking about it, but not too many people are doing it. And that is for residents to be allowed to spend 6 months in their 6th year in an area of their special area of interest, whether that's breast reconstruction, whether that's microsurgery, whether that's hand, whether that's aesthetic, et cetera.
I think it's brilliant.
Because most residents today, they're a very sophisticated lot. They're not like you and me when we finished, where they're not nearly as ingenuous. And they know what they want to do in the future, in their future practice. So why not allow them to spend that time not doing the same thing that they did for the last 5 years, but doing what they're going to be doing for the rest of their careers?
And when I was with Jim Lehman, we had a 2-week sabbatical where we could go anywhere. I spent 2 weeks with George Peck. Wow. What an experience.
Wow.
He said something to me I'll never forget. He said, if it doesn't look good on the table, it's not going to look good in 2 weeks.
Yeah. Well,
which is the way to say, this is your responsibility. Nature's not going to help you.
Think about if you had been able to spend 6 months
I know that.
learning rhinoplasty in your 6th year of training. Now, obviously, it was 2 years anyway. That becomes a problem. Our independent program is only 3 years, and this is a little difficult to do. But I think in the integrated program, it's very doable.
Yeah, I said that when I said that's brilliant because when you haven't gone into practice yet, you're not thinking about paying for the house. You might have children, but you're used to a certain lifestyle. Once you're in practice, you're not going to take 6 months off to go somewhere. No. So if you don't do it then, you're never going to do it.
Yeah, we've actually looked at that in an article we published in ASJ. That's part 1. We actually have part 2 we're about to submit, and that was we looked at reasons, looked at independent integrated residents and the reasons that people did or did not do postgraduate fellowships. Married individuals and independent residents were much less likely to do postgraduate training than integrated residents. As a matter of fact, up until a couple of years ago, every one of our integrated residents did a postgraduate fellowship. So the question is, how long are you going to make plastic surgery training? You're already at 6 years. You had another one that's at 7 years. You think about the time that we spend training. We spend about 1/3 of our careers in training. If you go to college.
Oh, I've done that. 10,000 hours.
College, medical school, residency, fellowship. We spend 1/3 of our entire career training. That's not a very efficient system.
Right. Well, and that's how long, because I read the book Outliers.
Oh, my favorite.
And the 10,000 hours, I said, okay. That's the number he picked out, but
10 years or 10,000 hours, right?
Right, yeah.
Right.
And the stories about the Beatles, and they were in Germany for 5 years. Nobody knows how.
Absolutely.
We spent easily
Bill Gates.
Yes, yeah, in the University of Washington.
Yep.
And I think that
Bobby Fischer.
Yes.
Right.
Yeah.
Sure.
I mean,
Right.
that's what was great
Right.
about the book.
Yeah.
He picked
Yeah.
these stories. I was
Yeah.
like, wow, I never thought about that. But yeah, our specialty requires a lot of time
Yeah.
learning.
Yeah.
And you only have so many years that you're going to be a productive person. But if you give up a third, but you have to do that because that's what it takes.
Absolutely.
You're not going to learn, I hope, from just a computer.
Right.
You're going to have hands-on.
Of course. Yeah.
What has been your greatest joy?
My greatest joy, I would say that my career, probably the highest point of my career was my presidency of the American Association, and specifically probably my presidential address. I think that was a high point, probably the high point of my career. It's something I'm most proud of.
Okay. And you kind of touch on this, but who do you admire most, professional or personal?
Well, I'm a big reader, and I love presidential biographies. And I would say that I am probably, there are a number of presidents that I admire the most, because, you know, we can help one patient at a time. So, you know, we're limited on what we can do in an entire career. These are people, actually, the better presidents are able to take people to places they don't necessarily want to go. So I would say, you know, people like Franklin Delano Roosevelt, Abraham Lincoln, Lyndon Johnson. These are people who had, you know, we think we work hard. We don't work nearly. We don't work nearly as hard as these guys. The stories that you read are just unbelievable. There's a story about Lyndon Johnson. Lyndon Johnson has a kidney stone. He's in absolute agony. He's driving in a railroad car, making stops during campaign. He'd get off the car, gave a speech, got back on there, writhing in pain. I mean, those guys are tough. These are individuals that really do some remarkable things.
Yeah. Well, that's an interesting look at it. Yeah, and I agree. People can complain about that. I said, I don't care if you get to fly on Air Force One. You're still on a plane for 12 hours. Yeah. And there's just a point where there's only so much you can do on a plane. And yeah, you're right. That's why their hair goes from dark to gray in 4 years.
Yeah, you know,
then to zero.
Those famous pictures of, you know, seeing the president day one and then president 8 years later, and how much they've aged. And the other very interesting thing is,
well, they don't get to sleep.
How depressed many of them become after they finish presidency. An interesting story about Harry Truman. Harry Truman finished his presidency, and he's driving in a car, and he says something is different. He couldn't understand what it was. They had to stop for a red light.
Oh. That he got used to that lifestyle. Interesting. Okay, I want to ask you what words of wisdom you would give for present and future generations of plastic surgeons.
Well, I think that's simple. I think that's very simple. You're gonna do best at what you love the most. So, you know, shoot for the moon. Go after what is you like to do the most, not what's going to give you the most financial reward, not what your wife or your siblings or your mother or father want, but what you want to do. And I think, you know, those are words that'll hold you in good stead.
Okay. And the kind of a last question, it may blend into the next one if we don't touch on it, but your predictions for the future in the next quarter century in plastic surgery, and your impression of AI and its effectiveness, or your feelings about it.
Well, I think the future of plastic surgery is very bright. We are the innovators. We are the people who take care of the complications. We're going to continue to innovate. I think we're going to see both prosthetic limbs become commonplace and better functioning with sensory input as well as motor input. I think we're going to see organ transplantation become a bigger part of our armamentarium in surgery. We're going to see tremendous advancements, I think, in immunosuppression that's going to allow us to do this. And I think this is all going to revolve around plastic surgery innovation.
Anything about AI?
AI, I think
I have mixed feelings about it.
I think it's got some pros and got some cons. I think it's gonna be a great help as far as teaching is concerned. Obviously, it can be abused, and we're gonna have to see how we're gonna handle that, and that we don't inject problems or malfeasance or negativity into the workplace. But I think it's gonna. It's very interesting. I think one comment was, well, AI, we can use AI to do our research for us as far as review of the literature. How is that any different from when we ask our resident to do that research for us? And we then write the paper. So, I think it's a gray line. There's going to be some rocky roads to go through, but I think ultimately it's going to make education far superior. Just like the internet, look what the internet did. You remember how you did your research. The internet has, just totally changed our approach completely.
It makes research a lot quicker.
Oh, yeah. Oh my God, of course.
Yeah. But then it knows everything that you do.
Yeah.
It's a double-edged sword.
Exactly.
Are there any other things you'd like to highlight or anything you'd like to bring up?
I would say, look, I would say if I were going to, would I do it again? In a heartbeat. I think it's been a great career. I think longevity is important. I think tradition is important. And I'm very proud of the residents that we've trained. And the way I look at it is I know that many of the residents I train will be better plastic surgeons than I ever was.
Well, Jim, it's been an honor and pleasure interviewing you, and thank you so much.
It's been a pleasure. It's been fun.
Yes, thank you. Thank you so much, and I hope you enjoyed this interview. All of my interviews are available online at meeting.aaps1921.org. I'll repeat that, meeting.aaps1921.org. And thank you.